Bed sores are easier to prevent than to treat. Mr. Sanal Kumar, aged 35 years, is bedbound after a recent accident. Anita is his wife and caregiver. He is being visited by nurse Sumi at his home. Good morning, Anita.
Good morning, sister.
Good morning, Sanal. How are you?
Good morning, sister. I'm doing fine.
Good.
Sister, I want to ask you something. I've heard that people who lie long hours on the bed develop bed sores. I change his position 2 to 3 times a day. Is that enough?
That is not enough, Anita. I shall show you the ways to prevent bed sores.
Okay, sister.
It is very important to change the position every 2 hours to ensure proper blood circulation. If patient has been lying on his back for 2 hours, turn him to one side for 2 hours. Remember to put small pillows between the bony points of the knees, elbows and ankles to prevent pressure on the skin. You can also use folded sheets instead of small pillows. Inspect all the pressure points with a torch. This is very important to detect formation of bed sore early. In a bedbound patient lying more on his back, inspect back of the head, shoulders, elbow, sacrum and heel. If a patient is lying more on one side, inspect ear, shoulder, hip, inner sides of knees and ankle. If there is any color change in the skin, avoid pressure and moisture on those areas. Using oil or lubricant, massage the patient's back with both hands in circular motion, stroke upward from buttocks to shoulders. This will help to improve blood circulation, preventing skin dryness and cracking. Turn him on his back after 2 hours. Then let the patient rest in supine position for another 2 hours. Again, turn the patient in other direction and maintain the position for 2 hours. Repeat this cycle and continue perform massaging and inspection. It is good to use airbed or waterbed as supporting devices to prevent bed sore. Do not make the patient lie directly on the airbed or waterbed. Always use a cotton bed sheet over the airbed or waterbed. If wrinkles are present on bed sheets, the skin rubbing over the wrinkled sheets may cause friction leading to bed sore. So, always provide a wrinkle-free bed. In case bed becomes wet, change the sheet as soon as possible. Keep the bed sheet dry always. If there is urinary incontinence, place a urinary catheter. Nails should be kept short. Otherwise, scratching can cause damage to the skin. Never drag or pull on a bedbound patient. If needed, patient can be lifted with the sheets. Healthy diet is important in preventing skin breakdown. Encourage the patient to take protein-rich foods like egg albumin, pulses, and groundnut. Drinking adequate fluids is important to maintain hydration of the skin. Patients using wheelchair should be made to lift their buttocks every 20 minutes. Use cushions for sitting on wheelchair. Inspect shoulder, buttocks, heel and ball of the foot. Hope you have understood everything.
Yes, sister.